guys, this is Christopher Hoffpauir. I am a doctor here at Winning Smiles Family Dentistry, and today I wanted to talk a little bit about guided surgery. What is it? What is the process of placing an implant? What should you expect? And so today there is a case I want to present. A gentleman came to me and one of his teeth had been broken off at the gums. We decided that it wasn't really savable, and so we decided to extract it, bone graft, and create a new skin product called PRF, or platelet-rich fibrin, where we actually draw the patient's blood, spin it in a centrifuge, and we isolate stem cells and fibrin, and we grow something that's a lot like skin so that we can actually put it over the area of the surgery to make sure that it heals very, very quickly. And so today he's coming into my office and we're going to place the final implant. I'd like to share with you how we go about planning this. First, a little bit of history. So in general, historically, a dentist would look at an x-ray called a panoramic x-ray, and that is a two-dimensional x-ray that represents the three dimensions of the head. But the problem is they're flat and there's no depth in them, and so you have to kind of make an educated guess, which I like to call imaginostics. You have to imagine what the bone looks like underneath. So a dentist would bring you in for the surgery, and they would take a scalpel and they would flap your gums, peel them back, and they would look at the bone. And sometimes they would say, hey, you need a bone graft in addition to the implant. And sometimes they would say, hey, I'm sorry, but the defect here is so big, you can't get an implant at all, or you'll have to get a bone graft and come back in 4 months before we can place the implant. So today that's changed a lot, or at least for implantologists who have a CBCT, or three-dimensional x-ray. And so today I'm going to walk you through the planning of this surgery, and I'll probably show you a little bit more than you're actually interested in, but I find it fascinating. So let me go ahead and get to that. Okay, so you guys can see that we have this patient here who presented with a broken tooth right here in the front left-hand side. And this is a CBCT, computed tomography, view of this patient. And what we use this for is so that we can plan surgeries in a way that keeps the patient safe. So we're going to go ahead and we're going to plan his surgery right now. So first, we're going to put an implant into the bone. We're going to look at where this broken tooth is. I want to center it about where the tooth needs to be later. And we're going to turn this implant so that it's going to go along the same direction as the previous route that it's replacing is going. We're going to make it a little bit longer, and we're going to change the type of implant that we're using to represent the kind of implant that we really want to put in here. All right, I think we get away with a little bit longer implant there. Okay, and now we're going to turn this to make sure that our implant is aligned with the long axis of the tooth. And then last, we're going to change the diameter of the implant to a diameter more appropriate for replacing this tooth here. We'll probably go with about a 4 millimeter. All right, now let's see what that looks like in 3D. All right, that is a pretty well planned implant. It appears to be coming out right where I want it. Now with this program, we can even plan out where the tooth is going to go. And so let's go ahead and take a look here at this patient. And that's going to give us a plan for the size and shape of the tooth. So let's move this on over. And then we'll move this so that it's a little bit more in line with where we want the tooth to be. Fantastic. And then last, let's go ahead and take this and let's go ahead and turn this down and match the image of the adjacent tooth. So we know we've got this guy right where we want it. Now I can go through hours of tweaking like this because, well, you may have noticed that most dentists are pretty detail oriented. But I thought I would share this one case with you, just so you can see what I mean about three-dimensional planning. Okay, so you guys have just seen how I plan a surgery before I work on a patient. Now the next part of this is going to be me sending off these files to have them three-dimensionally printed. And when we do that, we're going to get back a jaw. And as you can see here, this is a beautiful representation of this patient's mouth. You can see the area where we removed the tooth and we bone grafted. And then we also tell them, I want you to translate this surgery into a guide. And I want you to make sure that my surgery, whenever I do it in the mouth, is exactly what we planned on this CAD-CAM program. And so what they do is they three-dimensionally print the program that I made for the surgery onto a sleeve that fits over the patient's teeth. And into here, all of the drills and things like that for the osteotomy, which means removing bone, so that we can place the implant into the jaw. All of that goes through that little hole. So guys, instead of having your whole mouth flapped, this is the size of an implant surgery today, if it is done with the most modern techniques. And what that translates into is very, very quick healing for you and a very, very fast surgery, because you won't have to be there while the dentist is looking to see if the surgery can be done. He's already done the surgery virtually. So I hope that you guys think this is kind of cool. This is, again, guided implant surgery. And if you have any questions at all, go ahead and shoot us an email.